Yo, what's going on? What is going on? So, stepped outside, and in Florida, we spoiled, right? You know, we're used to it being hot 365 days of the year. The temperature may be around 60, and it is freezing if you ask me. So I had to be a little extra and put a jacket on. But I'm just going to walk around, try to get some sunlight. And it's important. You got to make sure you're getting sunlight. You got to make sure you're getting sunlight, especially if you're black, African American, you have dark skin, brown skin, black skin. You have to get vitamin D. You have to. Getting it in a supplement form is not sufficient enough. And also, we have to understand that vitamin D is not even a vitamin; it's a hormone. And so, when I tell people that, that usually helps them out as far as understanding how important it is. So while I'm walking around, which direction do I want to go? Another thing about Florida is we have a lot of gators. So I'm not about that life. And I don't want to roll up on a gator because I don't feel like, having to sprint right now. So while I'm going to walk, I have to be very careful about where I'm walking because I don't want to roll up on a gator. But I wanted to talk about a couple of things as it pertains to diabetes. So I'm always telling patients, you have to understand how your medication works. You don't have to understand it in a way where you can be a pharmacist, but still, I highly recommend that, not only do you understand how medications work, but you also have a basic understanding of our anatomy and physiology. Because if you don't, then it's hard for you to ask high quality questions to your practitioners, because you won't really be able to relate or understand anything they're saying or any advice that they're giving you. So particularly I want to talk about type 2 diabetes and two types of medications that people are usually prescribed. The second type, I'm not even sure why it's really still being prescribed, but nonetheless it is. And that's Metformin. And then the other class of medications, they're known as sulfonylureas. We have Glimepiride and Glipizide. Glimepiride and Glipizide. So let's talk about Metformin and how it works. So Metformin, for the most part, works. The mechanism of action works in three ways for the most part. The first part is that Metformin is going to inhibit the actual absorption of glucose in the intestinal lining. So when you eat food that contains carbohydrates, and those carbohydrates can be broken down, Metformin is going to actually decrease some of that absorption. So that's the first way. Now you're not absorbing as much glucose as you would have. The next way Metformin works is that it actually it slows down the actual release of glucose from your liver. So our liver is holding on to a lot of sugar, a lot of glucose in stored form is called glycogen. And so during the hours, so when you're actually eating, a lot of that glucose is being released from your liver into your bloodstream. Well, what metformin does is it actually decreases that sugar release, which is called gluconeogenesis. So it decreases that. And the next way that metformin works is by increasing the sensitivity of your cells to insulin. So those are the three ways that it works. This is why a lot of times people have a lot of stomach irritation, stomach pains when they're taking metformin, because that's the first way it works is by slowing down the actual absorption, which means slowing down the actual motility of the stomach lining and the actual intestinal lining. So some of the biggest side effects of metformin is stomach pain, nausea, vomiting. Also the B12 deficiency, because it decreases the B12. Also it decreases folic acid, and it also, the combination of those two also increases homocysteine, which has a high correlation with cardiovascular disease. Now let's talk about the sulfonylureas, Glimepiride and Glipizide. I don't know why these medications are still being prescribed, right? So let's talk about how these medications work. Largely, those two medications work by working on the pancreas. These medications, they go and stimulate the actual beta cell. So when we're talking about insulin, insulin is the actual hormone that's responsible for allowing glucose into the actual cells. We have 37 trillion cells. They all need glucose. They all have to run off of glucose. Well, insulin allows the actual glucose to go into the cell. So insulin is coming from the pancreas, but there is a specific cell inside the pancreas that secretes insulin. It's called the beta cell. So the sulfonylureas, glipizide and glumeperid, they stimulate the beta cells to actually release insulin. Now, they're going to release insulin. They're going to stimulate the pancreas, and the pancreas is going to release insulin on a continuous basis. So, with that being said, one of the number one side effects of those two medications, sulfonylureas, glimepiride and glipizide, is hypoglycemia. Hypoglycemia. So what is hypoglycemia? Well, this is when your blood sugar goes so low. A lot of times it's going to be below 70, below 60, but your blood sugar goes so low to where you're not able to remain conscious. You're not able to stand. You feel lightheaded. You feel dizzy. You start sweating, get clammy. You can't think clearly. And it's because your blood sugar supply is so low. Now, this is one of the main reasons why this drug was, there's been a sharp decrease in the actual prescribing of this medication, but still patients are still being prescribed it. I just finished seeing 2 of them, and they're young individuals. I don't know why is being prescribed, but nonetheless, so you'll hear a lot of patients complain about that happening, and the recommendations that they're given when they're told that that's happening is to go ahead and eat something. And then this is the reason why a lot of diabetics are told to constantly eat throughout the day. Check this out. When you prescribe these medications, whether it be Metformin, whether it be one of the sulfonylureas, Glimepiride or Glipizide, you are being prescribed those medications at a dose that's going to manage your blood sugar based on the foods that you're eating right then and there. So, what does this mean? This means that as long as you continue to eat the processed foods, as long as we continue to eat the diets that are going to help diabetes progress, those medications for the most part won't cause us any side effects that are going to be like hypoglycemia. You're still going to have the side effects as far as the B12 deficiency, the weight gain, PCOS from the sulfonylureas. But as far as hypoglycemia, you don't have to worry about that because the diet is going to continue to fuel that constant stimulation of insulin because of the glucose. However, and this is the crazy thing, however, if you're taking those medications and you decide that you want to start moving a little bit more, you decide that you want to start eating more, what happens? Patients will come in and tell you, like this sister I just finished speaking with, we're talking about the medications that she's taking, how she's doing with it and everything like that. So this is my first time seeing her. And so I was like, so let's start talking about the healthy eating. She told me she already tried that, but she had to stop because she was always feeling, she's like, I would try that, but I had to stop because in the morning times I would just feel real weak, lightheaded, and my blood sugar was like 65. And she was like, and so I just stopped because I was to the point where eating better, I think because she thought that she was so diabetic that she was permanently on those medications and that there's nothing she can do. Well, the reason why that's happening is because she's taking a medication called Glumeperid. And if you're eating healthy and you're taking these medications are not fit to deal with you while you're eating healthy foods. They're only fit to deal with you while you're eating unhealthy and while you're not moving as much, because this way, if you're eating the same foods that are highly processed, the medications will always have something to work with, specifically the sulfonylureas. Glipizide and Glimepiride will always have glucose to actually put into the cells because of the foods. However, when you start eating whole foods in conjunction with actually moving more, well, the whole foods won't be processed. They'll have more fiber and nutrients in them, because now with them having more fiber and nutrients in them, your blood sugar spikes or increases won't nearly be as high. Therefore, you won't need as much insulin because there won't be much glucose in the bloodstream. But what happens when you're taking a sulfonylurea? They're like, we don't care about none of that. Secrete insulin. And so the sulfonylureas, they beat up on the pancreas so much and make them secrete insulin. It doesn't matter how much glucose you have. The hit's already out. Your pancreas is going to continue to secrete insulin regardless of what you just ate or what you didn't eat. And this is what's causing the hypoglycemia. And this is why when patients start, I'm always telling, even if I'm working with online clients, we have to actually understand, have a understanding that you're eating better, you're moving more. Therefore, you got to work with your provider to actually help you decrease your medications. Now, whether they do that or if they do it on their own, because I'm going to educate them in a way where they'll be able to be independent. You'll know how to track your blood sugars. You know when it's time to, taper off medications based on my own personal case studies, because I won't be giving you any medical advice. But at the same time, you'll be so educated and empowered about how your body works and how these medications work and how the foods work, where things will start clicking to you. And so with these medications, once you start eating healthy and you start decreasing the amount of glucose in your bloodstream, that insulin that is being forced out of your pancreas because of the medications will now bring down your blood sugar so much so to where you have hypoglycemia and you start having issues with cognitive, like thinking, and actually being able to stand up, and having chills and clammy. That's what they call hypoglycemia. And so a lot of people go to the hospital for that. Matter of fact, I think the numbers are like, most people when they go to a hospital for diabetic issues, it's not because of high blood sugar. It's because of the side effects of the medication making their blood sugar extremely low. So this is why even with fasting, so this is the thing, and I'm saying this out of love, and y'all gotta know I'm saying this out of love. Medications are for people with medical conditions. Medications are for medications are for people who are going to continue to be quote unquote sick. Now, the sick word, I'm a little easy with, because there's a whole lot that goes into it. But you're going to continue to, the medications are going to continue to manage you. The medications are going to continue to make your numbers look. I got a patient. All right, I'm sorry about that. So I got a patient waiting on me. But yeah, so the medications are going to continue. They're going to be fine for you as long as you continue in that direction. But they're not fine for a person who's going to be improving their health. And they're not going to be pleasurable for a person who is actually eating better and moving more, because you're going in the opposite direction. The medications are going to be for you if you're going in the progression direction. But the moment you decide to turn around and start moving more and eating better, the medications are no longer suffice for you, because you don't have the unhealthy levels of blood sugar. The medications are for unhealthy levels of blood sugar. Therefore, if you don't have those unhealthy levels, you're going to start to have those side effects, such as the hypoglycemia. And so this is why it's important to make sure you work with your providers or someone who has the actual education and knowledge on how to direct you and guide you when you're doing these things. So that's why I need for everybody to really make sure they understand how these medications work on a basic level. And this is why, it's so empowering when patients actually are able to understand. And this is why there should be this education in the doctor's office or wherever you're going. There should be this education. Patients should know that if you're not eating, then you don't need to take metformin, because metformin, once again, works in 3 ways. If you're not taking in glucose, then what is metformin inhibiting? So there's no need to take it. And then also, that's why you would have a lot of stomach pain when you're taking metformin. But also, same thing with the actual sulfonylureas. If you are eating so much better and you are fasting and doing all these other things, then those sulfonylureas, they may cause more problems than they actually do good. Because, and also another thing, sulfonylureas, along with them causing hypoglycemia, they're also notorious for causing weight gain. Why? Because they're forcing your pancreas to pump out insulin. Insulin stores glucose as well as fat. And that's why sulfonylureas also increases the chances of you having PCOS for women and gynecomastia for men. PCOS for women is polycystic ovarian syndrome. Gynecomastia for men is pretty much when it's the flip. So insulin, high levels of insulin, which you get from actually injecting insulin plus taking the medications, it pretty much causes a biochemical sex change in the male and female. So men will start to exhibit more feminine characteristics. Their breast tissue will start to develop very differently because their testosterone is being decreased by the high levels of insulin. And for women, their estrogen levels is being decreased while their testosterone levels are being increased, causing what we call hair tourism. This is when there's an increase in facial hair growth, but also irregular menstrual cycles and multiple other things. So just make sure y'all know that. I'll be back on a little bit. I gotta go see a patient. But make sure y'all share the video, like the video, and check out the new program we have coming out. It's open right now. We haven't completely finished up the website, but you go and check it out. Other than that, appreciate y'all. Holla at you later, all right? Peace.